Hi, I'm Ravi.
And I'm Shell.
And you're listening to Two Lost Souls,
the podcast that guides you through the journey to becoming a CBT therapist.
Good morning, good afternoon, good evening, whenever and wherever you are listening to us. Welcome to Two Lost Souls podcast. And the title of today's episode is CBT from the Inside Out. I am one of your hosts, Ravi Amrith, and in today's show, we will be discussing everything to do with self-care and steps that you can take to look after yourself, not only on the training journey, but also throughout your career as a therapist. But let me begin by saying that this is your podcast guide to surviving a high-intensity CBT course. And we pride ourselves on creating a safe space for trainees, qualified therapists, and those who are generally curious. Honesty is our policy, and we tell it how we see it. But we'd love to hear your views too. As usual, I'm joined in the therapy room today by the marvellous Michelle Sudbury. How's it going, Michelle?
Really good, thank you. How are you?
I'm good. I've actually not had a boiler for a week.
Oh, no.
So that's been pretty bad. So if any listeners are making use of the new Smell the Presenters feature on Apple Podcasts, I apologise.
Well, I'm really glad we're doing this remotely then.
Yeah, well, thank you very much. Well, actually, maybe we weren't. Maybe you just felt you had to move back that distance to avoid the stench.
Yeah. Is it all fixed? Do you have hot water?
I don't yet. No, I'm still waiting for that. Yeah. How is your week going? How are you?
Not too bad. Yeah, it's going okay. It's early doors, but it doesn't feel like a Tuesday today. So yeah, it feels a lot more like a Thursday. It's been one of those weeks. But yeah, not too bad. It's all good.
Good. Brilliant. Before we move on, let me just remind all of you to get in touch if you have any particular questions or topics that you want to see covered. We have got some fantastic episodes coming up on working with ADHD, different career options that are available as well, and a whole host of other topics. So if there is anything that you would like to see covered, give us a shout. Reach out to us on Twitter at TLS_pod. Or send us an email at twolostsoulspodcast@gmail.com. We are very lucky to be joined in the therapy room today by Dr. Sarah Watts. So Sarah, thank you for joining us today. I know that you wear a variety of different hats, so I was just wondering if you'd like to introduce yourself and what you do.
Of course, yeah. So I suppose I've got three roles really that people might be interested in knowing about. The first is my main job. I'm the clinical director of the Staffordshire and Stoke-on-Trent Wellbeing Service, which was the IAPT service, now the Talking Therapist Service, because we're all trying to get used to the new name. I'm also at the moment seconded to NHS England as regional lead for IAPT across the Midlands. And my third role is I'm the programme director of the postgraduate diploma in CBT that my trust run in partnership with Staffordshire University.
Wow. Amazing. How are there enough hours in the day to fit all that stuff in?
That I work with a lot of very, very good people. It's a lot of very good team working, to be perfectly honest. It looks as if I do a lot of the work, but probably there's a lot of other people doing an awful lot of the work, really.
Got you. Okay. Before we kind of have a discussion about our main topic of the day, just what is your kind of background in terms of entry into the world of CBT and talking therapies, as we now call it?
So my original training was as a clinical psychologist. So I did a degree in psychology. I then worked as an assistant psychologist for a couple of years, 1 year with people who'd had head injuries, who were trying to get back to work. So it was a kind of rehab type unit, but a vocational unit. I spent a year working with people with learning disabilities, and assistant psychologist, and then was fortunate enough to get onto the doctorate course. So I did that. And then when I finished that training, I went and became the lead psychologist in South Warwickshire for mental health services for older people. And I was there for a few years doing various things with inpatient services and community services. And then wanted a bit of a change after a few years there. So came to Staffordshire as the lead of a very small primary care mental health team at the time. Things have changed an awful lot since then. We've now got a very, very big service. But in my first year in the job, although I'd got the clinical psychology doctorate, I didn't have BABCP accreditation because my doctorate didn't give me enough CBT to get accreditation. So I had to go and do the postgrad diploma in my first year of managing the service, which was a slight challenge, but I have to say I've not looked back. It's probably the best course I've ever done in terms of my career progression. So, and we've developed the service then in Staffordshire from a very small service. We're now working in North and South Staffordshire and in Stoke-on-Trent as well. So it's developed quite a lot in that period. So I did that course 10 years ago, coming up to 10 years ago. So, yeah, I've been CBT therapist for quite a while now.
Amazing. Fantastic. And one thing that I know that you're quite keen to discuss and quite passionate, and something that you promote on the course as well is a lot around self-care. Start with, and I suppose acknowledging that people are probably quite early on in their training journey when they're listening to this podcast, mm-hmm. or maybe haven't even started yet. Why the emphasis on self-care? Why is self-care and staff well-being so important in these roles?
I think there's lots of reasons why it's important at all different points of our career, really, isn't it? I think certainly for trainees, many people come to CBT training having had another profession, or they've done something else, they've had some experience either in another area of mental health or, something very similar before they come here. But I think during your training year, there's an awful lot of demands made of you. You're working, you're on placement, you're trying to meet all the demands of placement and get things right there and learn all sorts of new things, maybe even put down something completely that you've learned before and try and learn a new way of doing things. I know when I came from being a clinical psychologist to training in CBT, I had to put an awful lot down and, relearn things really. And that's difficult. But at the same time, you're trying to juggle lectures and supervision with different people, assignments, getting used to listening to the sound of your own voice on session recordings while you're practicing and listening to yourself, and getting used to the fact that other people are going to listen to that too. So I think it's very easy to get dragged down a rabbit hole of always being on and always being busy. And I think it's really important that trainees know it's okay to not do that. That's definitely not the expectation from people like myself, and that actually they'll be more productive and they'll be more likely to be able to think clearly and reflect on what they're doing and learn if actually they're looking after themselves as they go along, and they're taking their breaks and they're taking their leave, and they're building in self-care activities as they go. And I think if we can help people establish that as trainees, then hopefully they bring that with them into the qualified workforce, when obviously the demands of the NHS will be different, but just as challenging at different times. And I think for people to, sustain a career doing this kind of work wherever they're doing it, we've got to be able to look after ourselves.
Yeah, I completely agree. It's so I've been really lucky to be part of the recruitment process for new trainees. And I know that in the last few years, self-care has become a fundamental part of the interviewing that we do. We've had to adapt our interview questions to make sure that we're really emphasising how important it is that people understand what good self-care is going to look like, and highlight how demanding this course can be without scaring people off. So I think over the last few years, it's really shone, hasn't it, the self-care element of things.
Yeah, I think, COVID has presented us with 1,000,001 challenges. We know that. But one of them has been adapting to working remotely, hasn't it? And for a lot of people who were training remotely as well. And I think there were real difficulties in that, but maybe some of the positives in that were that, people weren't having to travel, people weren't, some people have quite long commutes to universities, don't they, into placement while they're training. And maybe, people have learned to build things into their day when they're working from home that perhaps there wouldn't be an opportunity to do in the office. And I think we've got to take the learning from that and try and keep it, haven't we? So that I think probably most people are hybrid working now and doing some working at home, some working, in university or in placement or whatever. But we've still got to keep those elements there to protect people, really, I think. And like you say, to get them through that really challenging 12 months of the course.
Totally. I mean, you mentioned remote working, obviously potentially presenting some both challenges and benefits during that period as well. And acknowledging that there was, I know the word unprecedented was thrown about quite a lot during that period as well. And that people were saying there were unprecedented impacts on mental health. How would you say that impacted on staff at the time? And I suppose where would you say we are now in relation to what changed during that period?
It's interesting, isn't it? Because I think different services did different things at that time. Our service never fully went 100% remote. We kept people in, and actually we made the decision to keep our trainees in the office and to have a small number of qualified staff in with them so that they still got that support and that mentoring, because we had a cohort of trainees who were 3 months into the course just at the point everybody went into lockdown. And it was a tricky decision to make, but we felt it was too vulnerable a time for people to be going home and working 100% at home without that support around them. And I think we had quite a different experience to several of the other local neighbouring services who perhaps did go 100% remote, and people had very different sort of experiences there. So it's difficult, I suppose, to comment around that. I think there's all sorts of benefits to working remotely for staff, obviously in lots of ways. But I think the isolation and the lack of the kitchen conversation, the one where you come out of a session and just go and say to somebody, gosh, this just happened, what was that about? Can I just talk to you about that? It was that kind of more informal contact that I think trainees and the workforce generally, I guess, missed. And I think that's why, hybrid working probably works better now, so that people get some opportunities to do that, but still get the benefits of home working as well. I think I certainly know it was incredibly difficult to teach purely online during that period, which we did. I think, again, it was the lack of the informal conversation. When you're in a big group lecture, people are less likely to ask a question or let you know that they don't understand something. When you're in a room, people will pop to you in a break and ask a question. So I think a lot of certainly people who trained during that period where we were teaching remotely probably had to hold a lot more of the anxiety than they usually did, because they didn't feel able perhaps to ask the questions they might have done otherwise. So I think it's quite interesting. People who trained during that period seem to be much more confident working online, with patients, which is an interesting thing, and actually have a preference for that because that's what they did during their training year, as compared with people who trained before, who have more of a preference to have some face-to-face working as well. It'll be interesting to see how this year's cohort, who we're doing a hybrid teaching arrangement with, how they feel at the end. Hopefully they'll feel competent in both ways of working, but we'll see at the end of the year.
In terms of, you mentioned that an element of particularly the training that you lead on is around kind of embedding those self-care practices in early during the training journey, and hopefully they'll kind of last throughout someone's entire career. What piece of advice do you sort of impart to the trainees on the course, or what are your top tips for self-care?
Some of it sounds a little bit twee, I suppose, but people learn these techniques to support other people in therapy, and I think sometimes we're the world's worst people at applying them to ourselves. So I think we do quite a lot of, when we're talking about various things, is there anything you can take from this to support you, to support your colleagues? If you're feeling anxious about something that's going on, or you've got a deadline looming and work's busy, what can you learn from the toolbox that you might be, if you were working with somebody who was in this situation and was stressed at work, what would you be doing with them? What can you apply from that? I think one of the biggest tips I give people on day one every year is beware the group WhatsApp chat. because that's always the thing that creates a huge amount of anxiety, and it's great to get information from, but there are times when it's helpful to mute it. And it's amazing how many people say to me at the end, that's the most helpful thing you said all year. It's great to have people connected, isn't it? But you do have to be a little bit careful. That's a real self-care technique to know when to switch off from that as well, I think, and just be with yourself and do what you need to do. But I think, making sure we're quite rigid in terms of how we structure training days with breaks, making sure people have got time to eat, people have got time to think. And I think that's important. And I think we hope that people take that with them in terms of how they learn to structure their day at work as well. It's so easy, isn't it, to not take a lunch break because you need to catch up on your emails or you need to read a paper quickly for university tomorrow or something. And, I try to model that as a clinical lead in the service. I try to model taking my breaks and making sure that other people take their breaks, that people are finishing work on time and are not, it's easy, isn't it, with remote working, take it home with you or don't switch the laptop off on time because you're still there and you can just carry on. But having those boundaries in place, I think, around, particularly if you are working at home, when are you working, when are you not working, and having a distinct switch off time. That used to be the time travelling, didn't it, between work and home? But, when you're working at home, having a distinct, right, I'm switching the laptop off now, I'm moving to another room, I'm going to do something else. If I notice people online late at night, and I sometimes do because I work flexibly, so sometimes I am there later in the evening, then, I'll drop people a message and say, what are you doing? What are you doing online? Switch off, go away, go and rest. And I suppose, it's for managers as well, isn't it, to support people. If people are struggling to fit everything into the working day, then it's our responsibility to notice that and, to talk to people about where the difficulties might be and what support they might need in managing their diary or reducing their commitments or whatever it is, to help them sustain the work they're doing. So I think some of it we try to model, some of it is explicit in how we talk to people about managing their time. I think that the kind of people who become therapists are generally very dedicated people and they want to do their very best at everything. But you can't do 100%. You can't be 100% at everything when you're doing this course. I think that's a piece of advice I'd give. And if you're trying to do that, you probably are going to end up getting overwhelmed with it. I think, aim for good enough, aim for passing and, doing as well as you can in the circumstances, not aiming for the 100% every time.
Yeah, definitely. Yeah. I think, you spoke a lot there about kind of modeling certain behaviors. Has that, and kind of acknowledging again this sort of sense of hybrid working or remote working, has that and has people's ability to kind of see that modeling changed as a result of that? And I suppose how has your modeling sort of changed as a result of the less that there being less visibility?
I think we try quite hard to stay connected. We have certain teams who are in the office together on certain days of the week. So, we sort of have mini teams within a team who are in together, and there'll always be a manager there with them. So, when I talk about the modelling, I guess I talk about our leadership team as a whole, really. It's not always just me, but we're very connected via Teams chats and things as well. We have whole service chats, we have smaller Teams chats, we have a good news chat where if people, do something well or got something they want to celebrate or something they want to say thank you for, people can kind of put that on there. And actually that's been a really good thing for people's well-being, because usually communication from managers is around things that people haven't done, isn't it? And actually making a point of saying the things, noticing the things that people are doing well that perhaps wouldn't have, that they're not like the big major life-changing things, but they're things that have really made a difference to somebody. I think that really helps. So, we can see when those chats are going, if they're going out of hours when they shouldn't be, we can sort of, communicate around that with people. And I think managers, leaders have got a responsibility to check in with their team, haven't they? Particularly when they're working remotely and they may not see them very often. I think the role of leaders and managers and seniors in teams has changed quite a lot, because you do have to check up a bit more, not in terms of managing what people are doing, but in terms of managing how people are and having that conversation with them. And just saying, how are you doing? Are you really okay? And asking a couple of times if needed, because it is harder, I think, for people to to talk to you about difficult things if they're upset or they've got something difficult going on personally. It is harder behind a screen, isn't it? It's easier to have that conversation when you're face to face with somebody. And if you're not face to face, how do you create that opportunity? So, yeah, we don't always get it right. I mean, who does? But I think it's something to be mindful of, isn't it? It's something that we need to make sure if we haven't seen somebody in the team for a while, or they've missed a meeting, or we've noticed they've missed a supervision more than they might ordinarily do, or the camera's off in a meeting and they'd usually have it on. They're the kind of times we might choose to check in with somebody and just say, are you okay? We've noticed there's something different happening.
I think that's a really good point. I know that before COVID, the way that our service has worked, we've always worked quite independently and in an isolated way. So very often you might have been the only therapist working from that particular venue, and you could go weeks without seeing anybody until it was time for supervision. And actually what I found is since we've been working in a hybrid way, the ability to just Teams call somebody and see a face, or schedule an impromptu kind of catch up, I've really benefited from that. And I think you're absolutely right. You can notice those subtleties. If somebody isn't attending meetings with their camera on, you can just inquire as to, is everything okay? Are you having a difficult morning? And you don't do that, do you, when you're kind of working in a scattered approach across a district, and you might not see each other apart from, every 6 weeks at your team meeting. So I found there's some benefits to it. But I was really wondering, Sarah, so from a manager's perspective, when we're kind of considering things like service targets, IAP targets, or talking therapy targets, and staff well-being, it's a really fine balance at times, isn't it? And I'm wondering how you kind of hold both of those things in your awareness to get the job done, to have the service delivery targets met, to meet the needs of the clients that are waiting for treatment, but also recognizing that our staff, our team members, might be struggling, might need a little bit of downtime, might need to cut their caseloads a little bit. It can feel a little bit conflicted to me. You feel like you're always having to justify to somebody why you're making the decisions that you're making. So I'm wondering how you manage that.
Yeah, it's interesting. Myself and a colleague run some training sessions around compassionate leadership for managers working in IAPT and for other staff as well. But, people who are perhaps aspiring to be leaders. And it's interesting because what you just said there is kind of the crux of it, really. It's how you balance getting the job done with looking after the people. It's having a foot in each camp all of the time. Because people often think that kind of a leadership style, is quite soft and person-centered perhaps, and is more focused on people, but actually compassionate leadership is about, as I say, how you get the job done while you're looking after your workforce. And my logic is very much, if you look after your staff will look after the work. So I think my emphasis will always be on, let's make sure the workforce are okay first and foremost, and then the rest will slot into place. Because if you go the other way around, you run the risk of the workforce disengaging and feeling very put upon, and quite rightly too. I would as well if I was in that position. So I suppose, for me, that's where I come back to the IAPT manual. There's very clear guidance in there about what people should be doing. We shouldn't be asking people to do more than that. We should be making sure people have got that time in between to do other things that interest them for their own, sometimes it's not about having downtime of doing nothing. It's about doing something different, isn't it? That's not clinical work back to back all day. We try and support people in terms of developing their own interests. We've got lots of champion groups in the service that people can choose what they want to get involved in. Our service we've got a bus, we've got a wellbeing bus that goes out and about into the community to kind of do different events with groups who may traditionally be called hard to reach. They're not hard to reach when you have a bus because you can get there very easily. People have the option of going out for a day on the bus to do some of these kind of community engagement activities, to places in the community that they might like to go to, or groups they'd like to particularly reach out to. So I think sometimes it's about mixing up what people are doing in the day and in the week as well. And I think when you do that, it's not hard to hit the targets from the IAPT manual, because, if you're adhering to that, not asking people to do more, and you're giving people lots of opportunities to do different things around that as well, it seems to work okay. Our service doesn't have a problem with waiting times. We've not struggled with that at all. We're still within target. And the team are generally really good at keeping us there. We don't tend to have too much of an issue with that. So I don't have to manage performance too heavily, because the team know what the targets are and they do it. They know what needs to be done. I might be completely deluded, but I'd like to think that's because we've got the other things in place reasonably well, so that the people feel secure in that and, feel able to get on and do what it is that they need to do. I'm not a big fan of the heavy-handed management approach in terms of the targets. And I think, sometimes as a manager, if you've got vacancies or you've got difficulties going on, you've got a lot of sickness in the team, actually, you just have to push back and say, well, we're not going to hit the targets this month. It's totally unreasonable. I'm not going to expect the team to do any more, because this is what they're supposed to do. Everybody's doing what they're supposed to do. We're just going to have to be clear that's not going to happen this month for whatever reason that is. And that, to me, is, that's the leadership role, isn't it, to protect the team in that situation as well. It's not about piling more and more on them to try and hit the targets.
Yeah, absolutely. Thank you. That was really interesting.
And you spoke there as well about self-care being quite an individualized thing. It's not always kind of the scented candle sort of thing. It can be just doing something that's a bit more fulfilling. I suppose just to address the kind of inverse of that, what are the signs that people should maybe look out for in terms of burnout? What are the early signs that they might want to watch out for in their practice or themselves?
I think the things I notice, if I notice people are starting to get stressed, one is their notes start to slip. Notes aren't done in time, or they're much briefer, or they're not written in the usual style. People's admin tends to go a little bit. They can usually keep up to speed with patient appointments, because that's something that people prioritise. But often it's admin, and you go into supervision and you notice the diary isn't booked, or the notes aren't completed, or something like that. The camera off in meetings is another one. People perhaps finding it harder to be present and visible in that situation. I think for trainees, quite often it's around when the admin slips, the logs aren't being filled in, or perhaps people aren't preparing as much for supervision, and they're coming in talking about a case but not really bringing a question with it, for example. And we're spending a long time hearing about a patient but not really understanding what the issue is, because the prep hasn't gone in beforehand. And I think as well for people, and this isn't something that anybody else can notice, this is something people notice in themselves, but I think when people start to get stressed, we notice compassion fatigue kicking in a little bit. And with the best will in the world, we want to be present for patients and we want to be doing what we can. But sometimes it's quite hard, particularly if you've got lots of patients booked in a day, or you've got a very long day of clinical work booked in for some reason, noticing perhaps your attention's wandering a little bit more, or perhaps you're not sticking to the plan quite so much. Perhaps, the agenda you went in with isn't quite happening, and it's becoming more of a free-flowing conversation. And I think, that's probably a sign you're getting stressed yourself when you're not able to be so present and so active in the session as you may need to be to support what your patient needs. So I suppose there's some of the things I'd be looking out for.
And I think really a helpful guide for people to kind of reflect on and maybe see if they've noticed that in themselves as well, as they go through. And I suppose, are there any more pieces of specialised advice, do you think, for the end of the training journey, in terms of recognising that people go from practicing about 3 days a week to making a big leap to practicing 5 days a week and generally seeing about 4 or 5 clients in a day? And I suppose what might they need to bear in mind or do differently at that point?
It's interesting, isn't it, as you say, because there is an increase in the clinical work and there's a decrease in the amount of supervision that happens when people come off the course as well. So it's not just more patients, but it's less supervision. So we try and work that as a transition. We don't immediately, in our service, we don't immediately expect trainees to be at full capacity clinically, and we kind of taper the supervision a little bit so that they're not suddenly going from twice a week to something much less frequent. So it's, I think people need to plan that ahead with supervisors and managers around what's going to work for them, and how that's going to be split up as well between face-to-face work and remote work potentially, because the logistics of that can be quite tricky, can't they? So yeah, I think it's worth thinking about, it's worth planning for, because sometimes people find themselves there and suddenly it all happens and they've not quite thought through how they're going to manage that. I think sometimes you can kind of ease the transition a little bit by making sure you haven't got all your patients at the same stage of therapy at the same time. So you're not suddenly picking up 10 new patients in the same week. That's really tricky, isn't it? You want people at different stages. So maybe seeing if there's an option of putting some assessments in to help stagger start dates of new therapy patients, just so that you've got things happening at different times. And if you've got, any decision-making ability around the kinds of presentations of patients that you're picking up as well, to make sure you've got a variety of different patients you're seeing, rather than suddenly picking up 10 new patients with one presenting issue that might be quite tricky, particularly if it's something like trauma. I think trauma is something I always recommend for newly qualified therapists, that they limit on their caseload and don't take too many patients at once when they first qualify. Because it's difficult, isn't it? And people need more time around it to think and process and plan, make sure they're doing the work. So I think, the other things that can be helpful are peer support meetings still in service. Most people have gone through a cohort of training with other trainees working in the service with them, and making sure you're meeting up regularly with your peer group just to kind of check in and, see what the issues are and whether people can support each other with things. I think people value that time as well, just to sort of stay in touch with the people that you've trained with who are at the same stage and might be facing some of the same issues. And I guess not being afraid to say if you're finding it difficult. I would always much rather somebody came to me and said, I'm really finding this tricky. Can you help me navigate this? Or, can we change this? Or can I look at this slightly differently? Because I think sometimes people still feel it's a weakness to come forward and say, I'm not managing this. And let's face it, we all have times, don't we, where we're not managing things. I have times where I go to my manager and say, I'm not managing this. Can you help me sort it out? And the strength is in being able to say it, isn't it? And noticing it and getting the help that you might need. So I think, start the conversation early with supervisors and managers and think about how you're going to plan for that period. And if it doesn't work out the way you want it to, don't be afraid to say, need to change something.
I think I'd like to add on that as well. That's really important. And I'm thinking about our staff members our team members who have been qualified for a number of years and actually spend a lot of time supporting our trainees, offering supervision, trying to enhance their own skills at the same time. So they may be doing top-up training, EMDR, mindfulness courses, etc. And I think there's almost like an assumption that you're an old hand now. So, you're competent and you should be resilient to the changes and the pressures of the NHS. But actually, the same things apply, don't they? You can face just the same kind of work pressures as somebody who's training or as qualified, or newly qualified. And asking for support at that stage is still okay. It's still okay to go to your manager, your supervisor, your peers and say, look, I'm really finding this difficult. I think it's a very pressurized job at the moment. And I think some of us didn't adapt very well to working remotely. Some of us liked it too much and have really struggled to go back into the office. And all of that, really, we need to hold and think, are we doing the right things for these team members? Because I do think we do place an awful lot of emphasis on our trainees, rightly so. And I think we might forget a little bit about the old hands who are just quietly cracking on and thinking they should be.
I completely agree with that. I think, it's checking up with the members of the team who are quiet is always important. It's easy to respond, isn't it, when people come forward to you? But if you haven't heard from somebody for a while, drop them a quick message. How's it going? Are you okay? Do you want a coffee? And just checking. I completely agree. And I think, those members of the team hold a lot, don't they? They tend to be the supervisors, so they're holding their own caseload, they're holding other people's caseloads. And I think making sure they've got a network is really important. In our teams, we have something called Happy Hour, which wasn't named by me, but it's a sort of team activity hour every month that people break up into smaller groups, and everybody has an hour every month in a smaller team to just do something that's kind of team building, or so people take it in turns to lead an activity. We've had all sorts of things. We've had tag rugby in the park. We've had Christmas decoration making. We've had all sorts of things. But I think, that they're the kind of times when teams can really come together and some people choose not to come because it's not their thing. Obviously, well-being is very individual, but it's really nice on those occasions to see those more experienced members of the team, and how they will come forward and lead activities, but also how they respond really well to newer members of the team coming in and kind of leading things. And I think however long you've been qualified for, this is one of the things I love about being the programme director on the course. It keeps me up to date with things. I love it when trainees come in and challenge and ask questions, and maybe ask questions you haven't heard before, or look at it in a slightly different way. I think that keeps me energized and keeps me motivated with what I'm doing, sort of knowing that you're supporting people who are being trained, but also that they're keeping you on your toes as well in terms of what you know. And I think that relationship between experienced members of a team and newer members of a team is really, really important, isn't it? It's not just a one-way thing. We need to value the connections going both ways.
Definitely, yeah. I like the happy hour idea. That sounds really good.
That was actually a pre-COVID thing. But people quite like it. It's quite interesting. We've had all sorts of things happening, but it's quite nice to just spend an hour together once a month as a team doing something completely not work related, isn't it? It's easy to get caught up in other things. Sometimes people would tag it onto a lunch break or to the end of the day so that things can go on longer. But it's quite a nice thing to do.
Yeah, it sounds great. There, it reminds me in I used to work in the third sector, and the substance misuse charity I worked for at one point had something called a wellbeing hour, where every single week they'd just give employees an hour to just sort of do whatever they needed to do, sort of recharge their batteries. They did have rules in terms of not taking it at the start or end of a working day, so you couldn't just use it to leave early, but you could do it to sort of refuel and do things to kind of resonate with you. I think, as you said earlier, knowing that compassion fatigue is a real thing, and it can be a struggle, particularly after a while. To have those sort of small activities dotted throughout a week or a month can be a really powerful way of kind of prolonging someone's ability to continue delivering really effective care as well. Is there anything else that you feel we need to kind of add or discuss in terms of self-care? Any other tips or hints?
I suppose the key thing, trainees often aren't at the very start of their career, are they? But I think it's good to maybe make a bit of a plan for what works for you when you're a trainee. I think that would sort of be the main thing I would say is, find out what works. There is a little bit more room in the diary at that stage, so you've got options of trying things out, haven't you? And seeing what works, in terms of working hours. We've got some people who regularly work late shifts. They work 12 till 8. They prefer to do it. Try out different working hours if you've got the options of doing that, and seeing what works with you and your own balance with your life. Life doesn't stop when you become a trainee, does it? You've still got other things going on. There's still families and friends and other activities and houses to run and, all sorts of other things that are going on. And I think finding that balance early on is really important, and then trying to work out a way of how you can keep implementing that throughout your career and adapting it at different stages of your life as well. I think that's sort of the main thing I'd encourage people to do, really, is to not prioritize work always, to try and find that. I know that's easy to say, but find that balance early on, and try and work out 2 or 3 things that are going to sustain you and keep you going, and work out how you can integrate those through your working week as you carry on. Because I think the people that don't do that will end up just working and working and working, and then they will grind to a halt anyway, and then they'll have to find out what works for them in their self-care. So it's better to be proactive and plan that in advance, isn't it, rather than find yourself in that difficult situation and then have to try and retrieve it and put things into place, at a point where it's much more difficult to do so.
Totally. I guess there's also something quite reflective, and I suppose people are going to have to be quite brutally honest with themselves. Particularly, I suppose there might be practitioners out there who feel like they can't switch off, or that they're kind of constantly in therapy mode potentially. And I suppose there's potentially a conversation to be had with themselves around why is that. And maybe asking those questions and finding out what the reason for that might be.
Absolutely. And sometimes they're very deeply held personal beliefs, aren't they? Or personal things that are going on. And sometimes we all need outside help as well, don't we? Sometimes we need to contact the Wellbeing Hub or occupational health, or perhaps seek some therapy for ourselves if we're really struggling. And I think, boundaries is my watchword, really, is if you're struggling to find those boundaries and switch off one thing and switch on the next thing, then, maybe that's a piece of work to do yourself, and on yourself, and to try and understand why that is difficult. Because if you don't have that boundary and it is hard to switch off, at some point that is going to become problematic. It might not be now, it might not be next year, but at some point it's going to become a problem, isn't it? So again, being proactive and trying to understand why that is and why it's difficult to put it down. It will still be there when you come back. There is always going to be more than enough work for all of us. And, even if you never slept again and you did therapy for 24 hours a day for the rest of your life, there would still be more work to do. So you might as well look after yourself and do a good job with the work you are doing, rather than trying to do everything. I think working in the NHS and working in therapy services generally, that there is always going to be more to do. But you need to be there to do it. If you're not in the room, you can't do it, can you? And if you're not well because you've overworked, you're not going to be in the room. So I think that's that's why it's important to me that staff look after themselves, because it's a tough job, and we need to be compassionate to ourselves as well as to our patients.
100%.
Definitely. I have no idea why, but as soon as you said performing therapy 24 hours a day, in my mind I just had this image of someone doing like a 24-hour therapy-a-thon for as like a charity fundraiser or something. If anyone has heard that and thinks it's a good idea, I would probably recommend not doing that. Particularly,
I would imagine by about hour 8 or 9 the quality would be going down a little bit.
That's true. Well, I suppose, are we going to get there and PHQ-9 and GAD-7 scores on an hourly basis during that?
Well, interesting to plot, wouldn't it? See what happened.
Well, thank you very much for your time today, Sarah, and thank you for coming on. Where can people find more about you and the work that you do? So
our services are on social media. So we're at MPFT Wellbeing, if anybody wants to kind of follow what the service is doing. My Twitter account is at ClinLeadsWBM. You'll find me via the MPFT Wellbeing sites anyway. And our website is Staffs and Stoke Wellbeing. If people Google that, they'll be able to kind of see what's happening in the service from there. But I'd be very happy to hear from anybody. If they've got any ideas that we can learn from, or if there's anything else that we can share at any point going forwards.
So, Shell, what did you make of that?
Oh, I'm going to do my gushing thing again. Yeah, I really enjoyed that conversation. The timing was just perfect for me because I've been feeling a bit burnt out recently, I suppose. So I think that the timing of that discussion was perfect. And what a knowledgeable lady Sarah is. She really kind of oozes that staff wellbeing is, or team wellbeing is really important to her. And I've always wanted to kind of work in that way. And I recognise that more recently I have been perhaps a little bit lacking in that area because of things like service pressures and some of the personal stuff I might have going on in my own life. I wonder if I'm struggling a little bit to, I don't know, be the kind of compassionate person that I've always wanted to be. So really good timing, very reflective on some of the things that she said. And I really hope that trainees and qualified staff find that episode useful.
Yeah, I definitely agree with that. And in a similar vein, actually, I thought I was in sort of an acute period of burnout, but it's kind of reached a point where, for me, I think I have let it slip a bit too much. So I think there were a lot of messages for me personally to take from that, if I'm being completely honest. And also a lot of really useful messages, not only for trainees who are listening to this, but also in terms of just informing the system and how the system works and how management can be a bit more supportive as well, and compassionate leadership. I think it was really nice to hear not only the phrase compassionate leadership, but also understand how that term is embedded into a culture and how it works and how it's operationalized. Because I think sometimes it's really easy to hear phrases like that, and they don't really lead anywhere. So it was really nice to actually hear how that results in initiatives to actually look after staff and to allow staff to look after themselves.
It really was. It's a great phrase. And I think having the explanation about how that looks as well, because you're right, it could have just become a bit of a buzzword. Let's all offer compassionate leadership.
Yeah.
But understanding how that actually looks in play and the benefits to the team, the whole team, not just to the person receiving that compassion. And that's really the focus, isn't it? Yeah.
Definitely. If anyone's interested as well, there was an IAPT wellbeing, staff wellbeing strategy that was released in, I think it was November 2022, which has a lot of things to be discussed in there, a lot of things to be reflected upon, and a lot of suggestions that you might be able to make within your teams for ideas on how to promote staff wellbeing and embed that culture of compassionate leadership within your teams as well. So I highly recommend checking that out as well. If you have taken anything away from this episode of Two Lost Souls, please hit that subscribe button on your podcatcher of choice, and recommend us to your friends or family. It really means a huge amount to us when you share the podcast. If there's anything you'd like to see us discuss in future episodes, give us a follow and drop us a line at TLS_pod on Twitter, or drop us an email at twolostsoulspodcast@gmail.com. As I mentioned earlier as well, we've got some really great episodes coming up on working with comorbid ADHD, and also things around potential career opportunities and what those could look like after accreditation as well. So stay tuned for those. And if you've got any particular queries about those, you know where to send them. All that's left to do now, though, is firstly say a big thank you to you all for listening, and also say a big thank you to Shell.
Thank you, Ravi.
Thank you. And to leave you with a story about two beavers who are sitting in a river. One beaver says, "You've been awfully chipper since you've been having those CBT sessions. And what's that in your hand?" And the other beaver says, "Oh, this. It's my positive data log."
Oh.
Thank you for listening, and we'll see you next time on Two Lost Souls. I'm keeping that laugh in because it counts.
Positive data log. That's very good. That's very good.
Thank you. Two Lost Souls was presented by Ravi Amrath and Michelle Sudbury. To get in touch, contact TLS_pod on Twitter or email twolostsoulspodcast@gmail.com.